Hello and welcome to a brand new episode of the Scientifique Pain Podcast. My name is Bart from Buchem. I'm a pain specialist physiotherapist. I'm the host today, and with me, Tim Beams, and founder of LePub. And we are gonna talk about what I think is a very interesting subject that probably resonates in many ways, but maybe needs some exploration. And we're gonna talk about reclaiming agency when the body feels like the enemy. And this is probably something that we read a lot about, but we really want to take a very clinical view on this. Apart from that, Tim has done some proper reading on this, and we're trying to give you some introduction on this. I'm putting you on the spot here, Timmy.
Thanks very much. Yeah, thanks.
No worries.
So why don't we just start with something? What is agency is probably a helpful starting point, isn't it? So I see agency as having the control, being the owner of you, your body, being the agent, as it were. So, and something that we talk about with pain, and I feel like this. I probably got this notion from Mick years and years ago. Is the sense that agency flips, and that the persistent symptoms, so our bias has often been pain, hasn't it? But it could be fatigue, for instance, dizziness, tinnitus, etc. But those unpleasant or aversive or valenced symptoms start to be the agent of you, of the sense of ownership of your body, of the sense of movement possibilities available to you, of the sense of what life has in store for you, and how you engage in life as well. So yeah, there's a bunch of ways that I think those aversive symptoms can affect us and affect the sense of agency that we have. So yeah,
there's this like unpredictability in it, right? It doesn't feel like me, or it's something you want to get rid of. But I feel as a clinician, when people say, I just want to get rid of my leg, basically, it's amputating this stuff. But with the pain comes the identity, or the body part, basically. They want to get rid of it. And I found that really struggling with it as a clinician, whether you want to go move with that narrative, or you're going to say, hold on, you need your leg, right? And people do understand that, right? So it's not something people do realize that it's a funny language, basically using it, but it's a big struggle. I think it's a hard one, without neglecting the feeling that people have at that stage.
Yeah, well, that's yeah. I mean, there's sort of the alienation of a body part, or the loss of confidence in a body part, or even the disconnection from that body part as well. That's been in pain, but and you could understand that if you're experiencing this persistent, horrible, distressing experience, that actually, if you were to just cut it off, then that would be it seems wise, actually, doesn't it? And could that help? In some people, amputation, for instance, has helped. But how do you amputate for tinnitus or persistent headaches, or
Spinal pain.
or persistent or persistent tummy pains and pelvic pains and things like that? So
probably this is a good where, and I think these are two, as you said, two terms are used: ownership and agency. Probably it's probably good to. Are they? Yeah, basically the question: are they the same thing?
Not necessarily. No, I mean, no, but they might be. They might be something that we experience together. So we have a sense of being a body, and having a body as well. So people can see us, can't they? That we have a body, but they can't necessarily see or know what it's like to be that body as well. So yeah, and the sense of ownership is important. You need to be essentially whole, don't you? And you hear that loss coming up in language sometimes. I suppose that sort of obvious ones are when people say things like "it" or "the leg" or something like that. That it at least it sounds like a disembodied way of communicating their embodiment towards you. So yeah, and we see that as well. People can disconnect. It can be a loss, a lack of ability to be able to bring that body part into your whole, to embody that part. That doesn't necessarily have this, it mean the same as having agency, although to be the agent of you, to be in control of your movements, you would assume that you need to feel whole as well, and be the owner, have ownership over that body part.
How does that relate to when people are losing something, but they're constantly checking, they guarding movement, they scanning their symptoms all the time, or they find it very hard not thinking about or not paying attention to that? How that relate to loss? Because I found that struggling when people say like, it's not mine anymore, but they are like constantly checking this and aware of the differences they are having or experiencing at that stage.
Oh, and that's a really good one, isn't it? So, I mean, I'm thinking that the way that your attentional processes are then determined in that sort of everlasting sort of loop here, perceptual action loop, is that you're giving greater weight to the difference between let's say the right and the left side of your body, and therefore it there's an opportunity for it to feel less and less like the body should or could, or your predictions are that it should feel like. So yeah, that constant checking in and noticing, and particularly noticing difference, probably just increases that feeling and makes
Yeah,
it more, and is a part of what can make it more persistent as well over time.
yeah, that's a really interesting take. I guess when we talk about hypervigilance and self-monitoring, but on the other end, there is this learning curve that people start becoming more and more detailed in their description of their body, especially on the body part that hurts. Um, is that like a logical response, you think?
In what, to be hypervigilant?
Yeah,
Or
people start self-monitoring, then become
yeah,
more. They
I
yeah.
think it's I think that's only natural, isn't it? That you check in, it doesn't feel right. You check in, you notice, you test it out. Am I still feeling it when I do this? And I've got back pain today, and I've done exactly the same thing. So, what happens if when I'm walking along, taking the kids to school? What happens if I just let myself relax a bit? And you will say, oh yeah, oh okay, all right. So it's still there, kind of thing. So, yeah, that self-monitoring is, I feel like it's just a natural thing, isn't it? That you heighten your awareness to something that feels a bit different.
Yeah. Is there also, maybe this is from the angle of suggestion. So if you self-monitoring a lot, you starting to feel things, you become more sensitive to all types of suggestions. What I kind of experience in the clinic is that people, that they feel what they taught to feel. That's my take on, right? Sometimes it feels outlined or whatever, and then we're going to talk about mirrors and vision and rhythm in a bit, but that it's really interesting how that experience is being not shaped by their experience only, but it's also shaped by a suggestion. If I think it's out of line because you've seen an X-ray on you whatever on social media, or this is your pain and this is the thing that's going on, and people start feeling that. I do see a relationship between people who are more sensitive to these suggestions relatively than people who are not that interested in the body or not so super hypervigilant. How is that relate to this?
Do you think that it's a time and place thing? So contextually, they might have been less influenced by, let's say some sort of societal message, whether it's something passed through school or parents or whatever, or that at a given time and place they might have just been like, it wasn't that influential, but at this time and place with this experience and this feeling, that it was had a stronger effect, was sort of more deterministic in that effect. I'm not sure, because I think we're like, it's a difficult one, isn't it, of going, there's so many potential influences, of what make us up through time, that to single one thing out, I'm not sure I'm totally comfortable with that, although it might be sort of heavily weighty at one moment in time. And I think my thoughts, particularly with the people I typically see, is that something that fuels that is often a notion of uncertainty. So we've all experienced pain and discomfort and, odd and not that pleasant feelings, but we've also all experienced them resolving in a way that's been fairly timely, fairly predictable. We've probably been able to do something about it, or something's done to us to do. I mean, think about children when they hurt themselves or they have a tummy ache, and how strong the power of a cuddle or a kiss or some cowpole is, and that you've got all these memories, these experiences imprinted on you that influence you over time. And I think the thing that stands out for me is when someone, they come to you and something that's not with everybody, but something that you often hear is, I've tried everything. I've seen loads of people. And it sounds logical. Like, I've logically gone through. I've done all the things that I would normally have done, given this experience, and I'm still feeling it. And there's a sort of drive there, isn't there, of uncertainty, of going, here's a bit more fuel for worry and anxiety and and everything else. to then go, do you know what? Maybe that thing that I saw on the internet about back pain is accurate, and I probably, maybe that's it. Maybe that's the thing that sort of makes most sense, doesn't it, at the moment, that I've whacked my spine out of line, or I've burst my disc or something like that. So
that's maybe this is a good time, or a time for bringing in some of the strategies where we can actually, when agency or ownership it comes through narrative and behavior. As a clinician, you probably observe that, and you found that at least worthwhile. Let's say, if we say, treating it, or at least create a context for change. How would that look like in your clinic? What will be from perhaps education through to experience, and then what are the types of strategies that seem to relate to this, and at least a shift in ownership or agency?
I mean, that's a massive question, first of all.
I know.
Because we could go everywhere
I
with
was
that.
thinking, have we done anything before in science sessions, or is there something on ownership and agency in our sessions we have in our premium, or is it something that
you've dropped me on the spot there. I'd have to go back.
Yeah, we've done all these
It
feels like it's been there forever, but
yeah. Well, look, the first thing is the sort of mutual understanding, and is often is just pointing it out, isn't it, and making someone aware. Oh wow, that's interesting. Do you feel whole? You know, do you feel like that your painful leg feels part of you? So that's often the starting point for me, and how could we make you feel whole again? What are the sort of strategies? And for some of the more, I suppose, the sort of stronger disconnect there, we have a whole range of possibilities. So graded motor imagery obviously fits really well with this, where we are asking someone to become more familiar, more aware of the fact that bodies exist, and those parts of the body exist, and those parts of the body exist in a number of different ways. Sort of bring it just into the awareness piece. So we're working on a more subconscious level before we move on from there. Then again, GMI has a visual piece, and we take a lot of weight through visual evidence as well, don't we? So anybody doing some movement where you're doing it in front of a mirror, or you're videoing it, or you're getting some feedback, that's all a part of helping to build that reassurance that I am the person controlling and doing and feeling. And I'm leaping over things quite a lot, but there's, at the heart of it, I have a sort of framework that I'm thinking about is relating to behavior change, but I think this fits a sort of predictive processing way of working with someone, is the need to get them to feel and reflect what they're doing as well. So it's no good to, let's say, get someone in a gym and just do some exercise. You have to be able to reflect back on how that feels and whether there's a difference between one side and another side, if we're truly trying to make someone feel whole again and feel like they're the ones in control of it. So there's a sort of depth in reassurance within that of being that agent. Then there's sort of, if we take, I mean, we're doing a whistle stop tour here, but it doesn't finish. The hope is that the work that you do with someone means that you leave them in a better place as an advocate for themselves. So the person who can take some really sensible decisions if they were to have problems into the future as well. So in terms of agency, I think that health literacy is a part of it as well. So you've got everything from sort of understanding and perhaps reducing fear relating to uncertainty in the immediacy. You've got techniques that we are grounding in science to improve ownership and agency. And then we've got the role of education in building health literacy into the future. So there's probably many more. I mean, I'm just sort of riffing most obvious things that are coming to mind.
But perhaps would be nice to a little deeper dive in mirrors and how visual input actually is being quite dominant in for some people at least. And by my experience, we do a lot being aware of the fact that visual input is not within physiotherapy or movement type of therapies. We may have underestimated the power of vision. And I think even mirror therapy is a bit not well understood, to be honest. It's been like, if you
feel like you prompted it. Here we go.
There we go. Yeah. There's so many ways. But understanding the effect, what does mirrors make so special? And what does it, the risks and opportunities that it creates?
I can't, do you know, there's a few different things, but the social construct of using a mirror to view yourself is an interesting one, isn't it? So, you know, just being able to look at yourself in the mirror. So someone who has, you know, a loss of agency, of feeling disconnected with their body, etc. Just being able to be okay looking at yourself, and you'll have had this when someone comes to your clinic and they might have put some more time and effort into their makeup. I had a patient not that long ago, probably beginning of this year, and she was telling me I'd lost interest in putting makeup on, and I've started to enjoy it again, and I've been exploring and trying different colors and making and it was amazing. I mean, she's an amazing woman, but it was amazing insight into that she'd noticed that, and she was using that as a way of taking back ownership of her body image in that case. So yeah. But mirrors, you know, typically, I suppose we often think of mirrors as a visual feedback tool, where we've already mentioned about maybe you're doing a movement in front of a mirror and you're watching yourself and you're getting some feedback, or someone videos you and you watch it. But in greater measure imagery, we've used mirror feedback as a way of presenting the opposite limb, so hidden limb behind there, and you know, so you've got, let's call this the open limb. We've got the open limb, we're looking at the open limb, and as we are just slowly moving that open limb, the reflection, and you probably can see I'm holding my hand underneath there, there's no way, like I can see my other hand is holding the mirror, but the vision has a dominant effect, and essentially we prioritize the information visually, at least if it looks congruent enough, if it looks believable enough, then we take priority over the proprioception and the interoception that we are likely to get from the hidden limb.
Is this about getting control back, or is that not the objective?
To a degree, yeah, to a degree it would be, to be the agent, then controllability agent of your movement. Yeah, absolutely. And it might be that the movement is restricted, but visually you're seeing slightly more or easier or freer movement in the visual representation, the visual feedback, than what's happening behind. And in a way that can kind of unlock that sense. It can sort of open up the movement opportunities, the movement possibilities, and yeah, from an agentic point of view, we haven't talked about affordances, have we? But you know, movement possibilities are essentially you know afforded us, and the movement possibilities can feel, particularly when pain takes agency over you, can feel quite limited. You know, the field of possibilities is very small. So using something like mirror therapy here is you're opening up that field, you're creating opportunities. It doesn't mean you're going to take them all of the time. It just means that it's more likely that there's a possibility in the future. So yeah,
would it be using exposure as a ground, like strategic tool, noting that it's something that if you're gonna stretch the affordances, you don't know exactly what's gonna happen, right? Because it can be problematic at some point for some people. But using exposure type of strategy that allows you to experiment and figure out how far you can go, or does that also, and that would be the question, is it the bigger the experience is for people, a larger affordance, does that create a bigger shift? Is that
we chatted about this with fibromyalgia, didn't we? So the difference between one and the other. I think for some people, the difference can be too much, too big, and it's almost dismissed. Or too big, too much of an error, you know, likely to feed a negative experience. So, you know, big difference doesn't necessarily mean better. for some people, it might be amazing to have that difference of going, oh wow, look at the difference that I can see at least movement. I think more typically it's a sort of drip, drip, drip effect where we're working on small gains, small wins, small differences, and building that up over time. But yeah, of course, it's not miracle cure, but you can see rapid changes in big differences for sure for some people.
Yeah, so trying to, it may need some surprise for some people, creating possibility. You talked about prediction updating, right? Basically saying, well, I thought I couldn't do this, and now I can actually have experienced something different that I thought I would experience before. I think that that's probably what allows us in the clinic to be more playful, right? To experiment. How do you introduce it? Because it's not the type of therapy you would expect. Are you going to run 3 sets with 10 reps of squats? But now I'm going to ask you to do something very funny. That's something very different. It's an experiment. How would you run this and communicating this to patients? When people say, well, I thought how many reps do I need to do? It's very practical, but it's probably not where you want to go through, right? So how do you introduce this to a patient to start experimenting this?
How do I introduce mirror therapy or exposure?
Yeah, for example, I think mirror. So yeah, you could, as a patient, you could like, how is a mirror going to be any difference?
Yeah.
Going to make any difference? Yeah.
Yeah. Totally. I mean, how? Totally. So someone needs to be open. I do exactly what you just said, actually. I say, would you be interested in having a little experiment and explore using a mirror? I don't know whether you've heard that mirrors can be effective in so I'm trying to go there with a relatively blank slate. I mean, obviously it's not going to be completely blank. There's going to be some predictions there already. And it's helpful to perhaps fairly quickly ask what those predictions are. What do you expect we're going to see? Or what do you expect to feel? And the interesting thing with using mirrors, and if you set it up well, and it does take some careful setting up, I think a lot of people throw someone a bit too quickly into a mirror without considering the plausibility and believability of the visual illusion, if you want. But if you do get it right, there is a very, very real sense of a feeling there. And a lot of people talk about, oh, wow, that feels a bit weird, or wow, I'm sort of in it now. It feels so real. And so you get some feedback straight away. And I think it's important to have that. Otherwise, why you like it's too unbelievable otherwise, isn't it? You need that felt sense, the experiential nature of doing it, in order for you to explore further with it as well.
Yeah, I think using a mirror for a unilateral pain in a limb, that seems to be logical. Like that opens up lots of opportunities. But how does it relate to, let's say, spinal pain or bilateral pain conditions? It feels a bit. I can see this question coming from a patient, even if they are very excited about the opportunities that arise here.
Look, the simple answer is it's super difficult with spinal pain. You can get feedback of movement looking at it, but it would be easier to get a video camera for your laptop and watch you in real time on the laptop screen. So you can hold it just behind someone, can't you? You can set up the laptop and you can get them moving or turn their head and whatever it wants. To be honest, a lot of people have never seen their back as well, have they? So you could take a picture of it or a quick video of it and show them and go, have you ever seen yourself move? I found that to be pretty powerful, actually, and go, wow, is that my back? Wow. And I didn't know it looked like this. And it doesn't look too bad after all. Because a lot of people, there's an assumption that they'll see something there. So yeah, that can be powerful. I think AI and VR are going to come in. AR and VR are going to come in here for spinal pain and robustness and resilience. I feel like that will be an area where, we're looking to do similar things here. We're trying to create a sense of ownership and agency, and we can even start to imbue that with characteristics of resiliency and robustness and flexibility and what have you. So I think that would be fun.
Exactly, it would be really fun. I remember a chat I had with Dan Harvey. It's one of the science sessions. It's a while ago, but it's still in our library. You can have a look at it as a premium member, as an avatar, like this embodied experience of a VR when people are basically dressed up as the Hulk and they felt stronger. So, and they were obviously, and I think what really struck me that someone and I don't know who I have to credit for this knowledge or this insight, was even hypnosis is a form of creating a state of mind. Whether you have an experience of your body, it might be very different, but it could be anything in a mindful state. So try to facilitate the state of mind that actually being required for the change. So people feel vulnerable, for example. How can you make them feel strong, or at least a little bit stronger, and then doing exactly the same procedure, for example. And this is part of the experiencing. This is actually quite nice when people start doing things in a different layer of their consciousness. So it's actually much easier. We don't need the AI or necessarily, or the VR to bring people in different states of mind. I think that's already available. But it will. I do agree that there will be some really exciting technology that will probably blow our minds in a positive way.
in a good sense.
In a good sense, blowing the minds. All right.
Yeah.
We're actually already running out of time, Tim. But allow me to, from a clinical point of view, to summarize what I think I took from this conversation. If you are, and correct me if I'm not fully complete, you want to address anything else. In order to bring this more experiential work with, for example, with mirrors in this particular example, is that you need a therapeutic alliance. That's probably it needs trust. I think that's a very good starting point. People will feel it, and how you introduce it. It needs to be safe. So think about safety from the patient's view. It needs some pacing. You can't do it and just do as much as you can, or it's a lot of pacing. Not overwhelming someone, avoiding threat escalations. For some people, it can be quite uncomfortable, and you just have to be there for them, guide them, experiencing. But it's also creating a little bit of a surprise, and using the same pacing again to follow up. And it has to be meaningful, I think. You made a few comments on that already. It needs to be the right context. And that's what you, as a therapist, you can create that context for sure. That's why introduction, like you said, of how it works and why it works is vital in some cases. Otherwise, people will just be maybe too not open enough. I would say that they might need to open up a little bit more before you starting or introducing the experiment can be quite important. So maybe agency isn't forcing the body to behave, but maybe it's rediscovering that participation is possible in that regard. Yeah. Anything I missed, Tim?
Yeah, well, we talked about agency and being the agent, and regaining, I suppose, the control, and part of that was the ownership as well. But we dropped in a few other things about movement possibilities as well. What's possible for you isn't what's possible for everybody else, and it's creating conditions where you're maximizing the possibilities available to you, and I suppose we haven't talked about variability and abundance and creativity and playfulness, but I suppose these are then other areas that we could explore, which I feel would would be really helpful if we're trying to create that sense of agency in an individual.
Awesome. That's probably where we're going to think about new sessions, and within our confidence coaching series you're recording currently, there's a lot of this already embedded, but I do feel some direction here we can take probably as a good next step, and being more specific on these really intriguing techniques and strategies that help you to treat people in long-term pain. So reminds me that I need to tell you about where the whole library sits, and if you're interested in all this kind of info, and we as clinicians want to support you in your work, as we do ourselves. So this comes from experience, but we have a huge library of great sessions that hopefully encourage you to maintain and keep focused on improving and getting more knowledgeable and more confident in treating pain. So everyone's welcome. Please join. Have a look at scientifique.com at our premium membership. There will be every second week so bi-weekly we have available new sessions, so it's digestible and easy to go. So thank you for listening to this podcast, and we're uploading a new session in a month. Thank you for listening.
Brilliant. Thanks very much.